So hi there. Thank you for joining the National Lupus and You event by the Lupus Foundation of America. My name is Ashley Holden, and I'll be the host for this evening's program. Our topic is going to be dental care and oral health. Here's a brief overview of our program. As you can see, we definitely have a full agenda. We are so excited and honored to have this evening's speakers. Tonight's a bit unique compared to some of our previous Lupus and You events if you've previously attended. We'll have two sets of co-presenters this evening. First, we'll have Dr. France and Dr. Trahan from the University of Pennsylvania School of Dental Medicine. Then we'll discuss accessing cost-effective dental care with Danielle Brown and Sandy Buechler. As you can see, we'll be covering dental care and oral health in depth, and a portion of this program will be dedicated to your questions and our speakers providing answers. I will kick us off by sharing more about the Lupus Foundation of America, some helpful resources, and some different ways you can get involved. A few housekeeping items as we begin. I know that we're all fairly Zoom savvy these days, but again, just a few reminders as we go through this evening's program. If you have a general question for our speakers, you can submit that anytime using the Q&A feature. You'll want to click the Q&A button at the bottom of your screen, and you can type in your question for our speakers. There should be an option to remain anonymous if you prefer that. Again, we will have that allotted time to answer these questions. We do our best to get to as many as we can, but sometimes we just run out of time, unfortunately. So if you were not able to get to your question or you have a question more specific to your situation, you can always reach out to our health education specialist, and they're available at lupus.org/healtheducator. Also, throughout the session, we'll have some poll questions where you can respond to. Also, feel free to use the chat feature to connect with others that are attending this evening's event. And finally, as a reminder, this program will be recorded. You'll receive a link of the recording along with helpful resources and a post-event survey where you can submit feedback about this evening's event. And again, you can rewatch this program or even other Lupus and You events by visiting lupus.org/lupusnu. So we have our first poll question, and give me a second. These usually take a second to pop up. So our first poll question this evening is, what topics are you most interested in for tonight's program? And you can check all that apply. The options are going to be how lupus affects oral health, lupus treatments and their impact on oral health, home care and dental considerations, how to get optimal dental care, and accessing affordable dental care. And I'll give us about 30 seconds to answer this poll. Okay, go ahead and take a few more seconds, and we'll go ahead and close out the poll and look at the results. I can't see the results. There we go. So it looks like a very big majority, 90% are interested in how lupus affects oral health. 71% are interested in lupus treatments and their impact on oral health. 46% on home care dental considerations. 43% on how to get optimal dental care, and 41% on accessing affordable dental care. So all very popular and relevant topics for this evening's program with our speakers. So again, before we start, just a little bit about the Lupus Foundation of America. If you're new to us or new to the Lupus and You events, our vision is a life free from lupus. We're committed to those with lupus. We know how difficult life is with this disease. And for over 40 years, we've been dedicated to improving the quality of life for all people affected by lupus through providing comprehensive support and programs to meet the needs of the community. We remain committed to doing everything we can to help you navigate the complexities of lupus while rallying every possible resource to end it forever. Today, people with lupus are living longer, healthier lives than ever before, and we really feel that the Lupus Foundation of America has played a significant role in that achievement. Our programs are based upon three key pillars, which include research, care and support services for people affected by lupus, and advocacy. Over the past 4 decades, we've supported more than 400 lupus research studies conducted at over 100 medical institutions. Investigators we have funded have contributed to many of the major advancements in lupus research over the last 40 years. We provide support, and our health educators, who are also in the background this evening, answer questions and bring hope to thousands of people every year. Not to mention, we're leading advocacy efforts to bring more funding for research and services. We've secured $550 million in federal funding for lupus research and education in just the last 5 years. Our advocacy efforts reach beyond securing funding. We've signed in support of nominations to extend Medicare coverage of dental services for individuals with autoimmune diseases who are receiving immunosuppressive therapy. This is just one example of how our advocacy and government relations team works to support legislation that benefits people with lupus, and it's a really great example based on this evening's topic. So our approach is comprehensive, as you can see with the different pillars. We really are focused on achieving meaningful results that will make a difference in the lives of people affected by lupus. People with lupus represent the heart and soul of our organization, and you are the central focus of everything that we do. And as you can see from this slide, we have the lupus patient in the center of all of these initiatives and our strategic outcomes. So really, we want to be able to expand direct services and increase access to treatments and care by providing resources and advocating for improved health services and affordable medications. We want to improve early diagnosis of people by increasing awareness of symptoms and educating health professionals so that people with lupus can get prompt care and treatment. If you didn't know, it can take an average of 6 years to receive a diagnosis. And also, we want to secure new, safe, effective, and here's the key, tolerable treatments for people by advancing that research and how about new treatments can be evaluated. And finally, we can't do all of this without funding. So really, we want to make sure that we're raising money and securing that government funding so that we can operate these programs that can help you. In the interest of time, I'm going to keep this brief, but I wanted to share about some of our programs and resources we do have available. So the first one is our National Resource Center on Lupus. This is your one-stop resource for all things lupus, from treatment to living and coping with the disease. It really aims to ensure that anyone affected by lupus, whether you're someone that thinks that you have lupus, you're diagnosed, a caregiver, or even healthcare professionals, all have access to high-quality resources that can provide emotional support, clear and accurate health information. We also have our health education specialists, and I know I've mentioned them a few times already. They are trained to provide people with lupus, their families, and caregivers with non-medical counseling, disease education, and helpful resources. They can really help someone find trustworthy information to answer your questions about lupus and how to cope with it. You can reach a health educator by visiting lupus.org/health-educator, or you can give us a phone call. Some of you have maybe already used this resource, but keep it in your back pocket for if you need it in the future, or you can always share it with someone that you may come across in your travels. Our health educators, we have 2 that are bilingual that can also answer questions in Spanish. We also have a network of support groups that provide safe and understanding environment where people with lupus can come together and ask questions. listen to others, or lend a helping hand. We have a brand new support group that's Lupus 101. If you're newly diagnosed, I encourage you to check that out. Many of our support groups are still meeting virtually, so you can join no matter where you're at. To learn more or find a support group, visit lupus.org/local support. All right, so some different ways we can get involved. So there are a lot of different ways that, you can get involved with the Lupus Foundation of America, but I really wanted to shine a light on our upcoming National Lupus Advocacy Summit. And this will be May 19th to May 21st of this year. And you can join lupus warriors from all over the country for the largest lupus advocacy event of the year in Washington, D.C. Attendees can learn from experts in the field about the latest lupus research, connect with hundreds of their fellow lupus warriors, and advocate for increased research funding, ensure access to care, and advance policies to improve the lives of all people with lupus. Don't miss your chance to turn Capitol Hill purple once again. Registration will be closing in a few days, I believe at the end of this week. So if you're interested in learning more and attending and registering, please visit lupus.org/summit. And then finally, if you weren't aware, May is Lupus Awareness Month, and May is right around the corner. The year is flying by, and this is a wonderful opportunity for everyone to join the nationwide effort to raise awareness and funds for lupus research and education programs. So you can help us make lupus visible this May. We have ample different ways that you can get involved, from hosting a fundraiser or an awareness event in your community, sharing your story, and spreading the word on social media. Put on purple for the But you can put on purple on May 10th, which is also World Lupus Day. It's a day when everyone gets their purple on to show support for all people impacted by this disease. So put May 10th on your calendar and make sure you get your purple ready. We'll also have a number of tools to help you spread the word and educate others about lupus. So be on the lookout. We have an awareness toolkit available on our website as well. All right, so I've seen you all be really active in the chat, and I see we have a lot of different representation from different states. So we'll do our final poll before I turn it over to our speakers. And so our final poll of this evening will be: have you ever experienced difficulty accessing or paying for dental care? And the options are going to be yes, no, sometimes, or I'm not sure. And again, we'll take about 20 seconds to answer this. All right, let's go ahead and make our final choices. So it looks like we're pretty split. So about 38% have had trouble, 34% said no, 26% said sometimes, and about 2% are not sure. So I know that that's very dependent upon the situation. Okay, so as I mentioned, I'm very excited for this evening's speakers. And so first we will have our first set of co-presenters. So we have Dr. France, and she is an assistant professor of oral medicine at Penn Dental Medicine. She obtained both her DMD and Master of Bioethics from the University of Pennsylvania. She went on to complete her residency in oral medicine from the Hospital of the University of Pennsylvania, serving as the chief resident during her second year. She currently serves as the director of oral medicine clinic and teaches clinically in that setting, the Care Center for Persons with Disabilities, and the Medically Complex Clinic in the School of Dental Medicine. She also lectures to dental students and residents on a wide range of subjects relating to oral medicine, ethics, and professionalism and patient management. Her scholarly work focuses on how changes to medical care can impact dentistry, including both the delivery of safe care and recognition of trends and changes over time. In addition to her faculty responsibilities, Dr. France also serves as an attending dentist at the Hospital of the University of Pennsylvania and treats general dentistry, medically complex mucosal disease, orofacial pain, and oral mucosal lesion patients at the Penn Dental Family Practice at University Center. or University City, I apologize. And then we also have Natalia Trahan, who is a DMD in the class of 2022. She is the chief resident of the oral medicine residency program at the University of Pennsylvania School of Dental Medicine. Dr. Trahan graduated from the Medical University of Łódź in Poland, please forgive my pronunciation, in June of 2022. She has acquired diverse experience working in the summers during her dental school years in Malta, Toronto, India, and the USA. Throughout her dental school, Natalia volunteered in the oral and maxillofacial department, and throughout her dental school, Natalia volunteered in, I already said that, I apologize. She is also a healthcare ambassador with a nonprofit organization, Take a Pain Check, that empowers youth with chronic illness to advocate for themselves. She is passionate about oral medicine and surgery. She plans to pursue a clinical and academic career in diagnosis and surgery. And again, we are so thrilled to have you. Please feel free to take the slides when you're ready, Dr. Franz.
Thank you so much, Ashley. Thank you everyone for signing on tonight, and thank you to the Lupus Foundation of America for having us. It's truly a pleasure to be here and have the opportunity to speak to you all about dental care and oral health in the context of lupus and its treatments this evening. As Ashley mentioned, my name is Dr. Catherine France. I'm an oral medicine specialist and an assistant professor at the University of Pennsylvania. I do see patients in several settings in Philadelphia, and I have the pleasure of presenting this evening together with our chief resident, Dr. Natalia Trahan. I'm going to start first with creating the connection between lupus and oral health, something that may be more familiar and seem very clear to some of you and maybe more nebulous to others. But it's important to say right at the outset that this is an extremely broad topic, and therefore we won't have time today to get into the details of all the different connections between lupus and oral health. Rather, we hope this presentation can continue the conversation about the importance of the connection and provide some useful thoughts on how to use oral health and oral care to optimize your overall health. We can go to the next slide. Thank you. In terms of what's ahead tonight in our presentation, we have a multidisciplinary approach. We're going to focus on linking rheumatology, dental medicine, patient perspectives, and ways we can use care to improve patient management and meet mutual goals. We're going to start by creating the connection, like I say, looking at the dental specialty of oral medicine and thinking about how we can partner with other providers in patient management. We'll then talk about both how lupus may manifest in the mouth, using a few examples, as well as some oral health considerations of how lupus may have the chance to impact various structures in the mouth. I will also touch briefly on the impacts of treatments on oral health. And then after that, Dr. Trahan will dive deeper, first by flipping the perspective and looking through a patient lens, sharing results from some surveys that our team created and distributed that looked at knowledge, attitudes, and actions related to oral health and rheumatologic health. That was a survey distributed last summer in coordination with the Take a Pain Check Foundation that Dr. Trahan works with, and using networks of colleagues and patients to better understand perspectives. Then we'll transition into looking at some additional clinical pearls for successful care through building partnerships between patients and across providers. And although today's presentation only skims the surface and much remains unknown about this topic, we do hope to add some helpful understanding to take and apply to your own experience. Next slide, please. To further expand on general objectives of this group in our presentation, we do want to help illustrate how a partnership between oral medicine and rheumatology can improve care for patients. To understand what's known so far about the interplay between lupus treatments and oral health, to consider both the evidence-based and patient-sourced opportunities for better care, recognize patient and provider perspectives on the connection between oral and rheumatologic health, and understand some modifications that may improve treatment for these patients. Next. So I do want to start, as promised, with the officially recognized definition of oral medicine as a way to make the first link between lupus and oral health. So oral medicine is defined as the specialty of dentistry responsible for the oral health care of medically complex patients, which entails determining if patients are fit to receive care, what limitations should be placed on that care, either in terms of timing, location, nature of procedures, or how they are performed, and managing delivering that care safely. Oral medicine is also responsible for the diagnosis and management of medically related disorders or conditions affecting the oral and maxillofacial region, including oral manifestations of systemic disease and local oral lesions, as well as orofacial pains, which can stand alone or be part of a larger experience of pain, as in rheumatologic disease, including lupus. I know we already had a question on that, so the answer is essentially yes, and we'll continue to get into this. as well as salivary gland diseases, which again can be either isolated or a component of a more generalized disease process. Next. Some more casual definitions that I hope shed light on the scope of oral medicine are listed here. We're really positioned at the interface of medicine and dentistry, and oral medicine practitioners are able to bridge the divide to really serve in both medical and dental settings as a specialist or physician of the mouth. We reach difficult diagnoses through complex evaluation and workup and provide a wide variety of modalities of treatment for a broad range of conditions. We also work with both our medical and dental colleagues to coordinate and properly plan and execute care. This is all directly relevant to our conversation today because we as oral medicine specialists have the knowledge and experience to work with our medical colleagues on how overall treatment plays into oral care, and work with our dental colleagues to educate them and help to guide appropriate care, make recommendations, and manage and control oral disease manifestations when they do exist. We also are sometimes involved in the investigation that does lead to that first diagnosis or a confirmation of whether oral lesions are related to systemic disease. And so hopefully with all that said, you can agree with me that oral medicine specialists can be an important part of your care team and a helpful or sometimes even essential part of the overall coordination that can help fill in expertise that may otherwise be missing on that team. In support of that, I added some photos to hopefully make us feel a little bit more human and a little bit more approachable. These are recent photos of our team, as well as some information on our national association, the American Academy of Oral Medicine, as well as their Find a Doctor link at the bottom, which can identify both specialists and general dentists with additional oral medicine expertise who might be in your area. We are a small specialty, so sometimes it doesn't cover every single place, but hopefully this can be a helpful resource. Next. As specialists, we do care for complex conditions of the orofacial complex, and so that does include manifestations of a wide variety of systemic conditions, including rheumatologic conditions such as lupus. This can include the issues that come directly from lupus or indirectly as the result of medications or other changes. And either way, oral lesions and other issues like pain conditions can all have a major quality of life impact, as I'm sure some of you can testify to us all. These conditions are usually best addressed through co-treatment between oral medicine specialists and other medical team members to ensure that everything is fully evaluated and comprehensively addressed. Next. So what really are we talking about? Oral lesions are common in both cutaneous and systemic lupus, and while they do not affect all patients, one study did find that their presence is up to 70% of patients. These can take on a wide variety of appearances and cover a number of different oral tissues, including things like ulcers, which may appear in up to a quarter of patients with lesions, as well as lesions that may be red, white, or a combination of the two, sometimes taking on kind of a mixed white and red appearance, as shown in the photo, which we call lichenoid, just a technical term. Other appearances are also possible. Some include pigmentation, fissured or cracking of the tongue, and conjunctivitis, which is a dryness and cracking of the lips. What occurs in different patients tends to depend on disease appearance and severity, and may correlate to systemic disease activity and duration and systemic steroid use, again, including both the dose and duration. This may also have some connection to oral hygiene and certainly can make oral hygiene difficult to complete, as we'll talk more about in a few minutes. Next. Sjögren syndrome is also a highly relevant oral condition to consider, and in the oral cavity consists of decreased salivary flow and can be either as a direct function of that independent disease or a secondary effect of another disease like lupus. Sjögren's is the second most common autoimmune connective tissue disease in the world, and possibly the rheumatic disease most readily and commonly associated with the oral cavity, where it can devastate a patient's function, including speech and swallowing, their comfort, and their quality of life. In addition, local impacts of decreased salivary flow can include high rates of dental decay, as illustrated in these photos, high risk of infection, particularly fungal infection, and a high rate of trauma through loss of lubrication normally provided by the saliva. That results in areas of wear and even ulcerations to the tissue. Next. In terms of treatment and their impact on oral health, in general, the main effects of treatment overlaps with what we've already covered, dry mouth due to medications, and the good news is that many other medications do not have clear proven negative effects on oral health. However, we can also consider specifically the needs of patients on low-dose systemic corticosteroids. Those on low doses do not require routine additional steroids for dental appointments, including for minor interventions, while those on higher doses undergoing more involved or particularly high-stress procedures may need some additional steroids for the day of the procedure. One other known effect of medications to be aware of is that hydroxychloroquine or Plaquenil can cause a characteristic graying of the palate, as seen in this photo, which may be noticed either by the patient or the provider. That said, to say again, impacts of medications for the most part tend to be theoretical as opposed to proven out in the data. There is a concern, for example, that your immune system might be suppressed, and that may affect recovery after treatment. But mostly patients are actually found to tolerate treatments quite well without the need of additional medications or dose adjustments. What's recommended instead is close monitoring of the disease and medication status, a recommendation that comes from both in-depth study and medical context and best practice. Next. To spend one last moment, as again, this may be relevant to some, we will review some possible risks of biologic agents. So in lupus, this is going to primarily be belimumab, which is used in patients who have had trouble with disease control, although the other agents listed here may also be used and familiar to some of you. The data on this subject is severely limited to date, and specifically the impact of the medications on oral health is unclear. What is coming out, though, is that these patients may be found to have increased dental disease burden as measured through an index called decayed, missing, and filled teeth, which is pretty self-explanatory. That could come from a wide range of factors, such as decreased access to care, which we'll discuss in a few minutes, dry mouth secondary to disease and medications, and possibly even direct effects of either disease or medications. There may also actually be a protective impact, though, of biologic therapy on periodontal or gum disease, such as in areas of bone loss, bleeding gums, or need for deep cleanings. Patients do seem to have low rates of complication after dental extraction, mainly limited to pain. And although rare, oral lesions have been reported in conjunction with and possibly even secondary to biologic treatment, including some of the ones similar to, but also some distinct from the lesions we tend to expect from lupus. And at least in theory, as we've seen before, there may be an increased risk of infection in these patients that could apply to the oral cavity. Next. So with that whirlwind overview of how lupus and its treatments relate to oral outcomes, we'll transition to considerations of treatment for oral lesions, oral health measures, dental treatment need, and ability to access care. And again, I'm reviewing what's known in the existing literature on oral health considerations to set the stage for our review later of patient and provider-based perspectives and some solutions to improve oral health and communication in the future. Next. We'll start broadly with the importance of multidisciplinary care as it relates to the oral cavity. I know that many in our audience today are experts in the importance of multidisciplinary care, and some of you, I'm sure, are specifically experienced in how important this is with oral care. But just to make sure we're all familiar with this point, there are several things to remember. One is that, again, the majority of cases of lupus will have oral lesions. To add to that, there's some variation across subtypes, with lesions sometimes coming up early in the course, sometimes even as the first lesion that may appear. And sometimes lesions also resist other treatments, can last quite a while, and are generally slow to heal. For this reason, we want to make sure that we have follow-up with specialists, ideally in oral medicine, as we just discussed, or maybe specialized dermatologists or others who can monitor these lesions. We also, as with other areas, want to ensure clear and frequent discussions with other providers and clear communication between members of the treatment team to ensure that we're all thinking about the same things and considering our steps in association with other needs. However, oral monitoring of disease is an essential component and may include things like biopsies, either at the beginning of treatment when oral lesions form, or sometimes for ongoing monitoring of suspicious areas or new evolution. With biopsy, accurate technique is essential, again, emphasizing the importance of experienced specialists who know about oral care. And as with systemic disease monitoring, all of these approaches can contribute to long-term follow-up together with clinical evaluations to evaluate nature and extent of disease involvement going forward. Next. When we do look at patients with oral disease and start to think about treatments, we want to consider first and foremost not only the severity of oral disease, but also whether this is currently present on its own or as part of a larger disease flare. When we do see a patient with disease limited to the oral cavity, sometimes we don't even need a new systemic treatment or any systemic treatment right away. And while we do know that lupus, of course, can evolve over time, we want to keep patients effectively treated with minimal and safe treatments as much as possible. On the other hand, there are patients on systemic treatments where sometimes this has been sufficient to control oral disease, bringing down redness, ulceration, pain, or any other manifestations. And then, of course, the third option is a patient who is systemically well controlled and is responding to the medication as expected, but still have oral disease or may have new oral lesions that are resisting control that may need additional active oral treatment. Oral cavity education and evaluation and ongoing care are also important to monitor for new and existing lesions, development of new lesions, asymptomatic lesions, such as that gray palette that we talked about earlier, or other things. And another thing that providers are always carefully looking for is things like dry mouth, which, as we said, can cause additional discomfort and complications and exacerbate other disease processes. Next. When we do look at what we use to control oral disease, some of these may again be familiar to some and not to others. There are a wide variety of options to consider, so there's always something new we can experiment with, especially in those cases where disease may be resisting control. As with skin lesions, a lot of times these include topical corticosteroids, including a variety of different formulas of these agents. It's difficult in general to get these medications to stick to the oral tissues, but we try various different ones at various doses, and we try some supplemental measures to help them soak in, like trays and gauze. We can also try things like intralesional injections, either with steroid or local anesthetic, to try to control either single lesions that are not responding or areas that are difficult to access with medications otherwise. That's illustrated in the bottom picture. We often use antifungals for two different purposes. One is to prevent development of a yeast infection. Most of us have yeast in our mouth at baseline normally, and that can act up both when patients are using steroids in the mouth and particularly in patients who have dry mouths. So we often use it to try to prevent a full-blown yeast infection, or on the other hand, for treatment of an active yeast infection when that does develop. There are also other agents that we can use for control of oral disease, all of which have support in literature, but have different pros and cons, one to the other. And depending on the person, there may be the need to try different treatments for lip lesions versus lesions that are in the true oral cavity or the mouth proper. Next. We can also think about dry mouth on its own. That impacts, as we said, many patients, and it's both a direct disease impact and a secondary effect of the medication. We have patients both with primary and secondary Sjögren syndrome, probably here today in the audience. They're relatively common, affecting 1 in 70 and 1 in 35 patients respectively, and directly causing decreased saliva production. Dry mouth can also, though, be caused by many medications. So 106 medications have strong to moderate evidence of causing salivary gland dysfunction or dry mouth. And to look at frequency, 30% of adults over 65 and 40% of those over 80 do report dry mouth secondary to medication and for other reasons. We do know that this has a very negative impact on quality of life, as mentioned, through difficulty eating, speaking, and swallowing, through a high level of discomfort. Solutions will be expanded on later in the presentation, but dealing with dry mouth can also make it much more difficult to manage oral hygiene. Certainly, that can also lead to increased dental disease and the need to change the regimen of other agents and add agents to try to optimize oral health. Next. Thank you. We can think as well about caries or dental decay and periodontal or gum disease. To start with caries, there is mixed evidence on the rates of dental disease, but patients with lupus do seem to have more decayed and missing teeth than healthy controls. That again may connect back both to dry mouth and difficulty maintaining home care. While in terms of periodontal disease, rates seem to be higher than in other populations as well, probably due to some evidence of higher rates of inflammation in patients that may lead to disease progression. And there are studies suggesting possible improvements to systemic disease activity after periodontal treatment, underlining the importance of coming and getting appropriate dental care and routinely updating it. Next. In general, for these patients, we do know that there's a high overall dental treatment need and a general low oral healthcare related quality of life. There's also a common challenge with completing oral hygiene, whether that be due to the impact of dry mouth or oral lesions, such as ulcers and other painful conditions. In fact, a study looking at dental care experiences through interviews found that oral hygiene can take long periods of up to an hour and can require multiple tools, particularly depending on the level of need and in cases of flares. And studies also find that in these patients, previous experiences shape attitudes, as it does for all of us in all settings. That underlines the importance of a caring and informed professional who can treat people appropriately from all standpoints and help connect patients to the appropriate care. Next. So if we think about access to care, we do find in literature that patients visit dental professionals less than healthy controls. Patients may have many factors that limit this access, including difficulty managing all of their different treatments needed and challenges with their underlying conditions, as well as difficulty tolerating appointments that may lead to decreased care in the moment and prevent initial seeking of care. To make things worse, patients may need more frequent appointments to deal with more severe periodontal disease or the impacts of limited home care, but the cost of frequent appointments can be prohibitive for people. And although cost is a common concern across the general population, patients with lupus may be particularly limited due to the cost of medications and the cost of other visits, which may be prioritized. And lastly, as is so often the case, and as we've already talked about tonight, patients have also reported the need to advocate for appointments and the modifications needed, again, showing the need to proactively come together to better serve the population. Next. I want to take just a couple of minutes at the end to talk both about what to expect from dental care and what you consider as you work towards comprehensive disease control. Because the inflammation inherent to lupus and the difficulty of maintaining proper home care due to discomfort and disease flares, frequent dental cleanings are important and may be considered at 3-month or so intervals. Depending on the level of disease activity, successful completion of cleanings may require various different modifications, such as using numbing agents, finishing one side and coming back, completing the cleaning in multiple visits, or other considerations, but should be maintained wherever possible. It's also possible that other dental treatments may exacerbate oral disease by adding inflammation or causing trauma. And after all, dental treatment is expected to have some bleeding and swelling in patients with lupus. However, maintaining good oral health is the best way to keep all of this under control, and maintaining good home care is essential for control of all oral diseases. Next. Some other thoughts about dental care include that completion of any needed care may be best done during periods of at least relative disease control, given the possibility for treatment to exacerbate oral disease. As we mentioned, patients should have careful follow-ups with their dentists, as well as with oral medicine and/or any other specialist that they're seeing in order to monitor for changes and optimize oral care. From the dentist side, it's important for us to be as gentle as possible and try to minimize the increases in inflammation caused by cleanings or any other treatments, while still being thorough and completing our tasks. Dentures should be as smooth and polished as possible to minimize additional trauma that these could cause the tissues. If this feels relevant to you, and you think that maybe the polish on your denture should be improved, please let your doctor know about areas of irritation so they can smooth it. Any soft linings can even be added to dentures to help patients with more significant active disease try to minimize any local trauma to the tissues. Next. In case this last piece is relevant to you, I did want to include some thoughts on those that may need more major or invasive dental treatments. So maintaining and being gentle is all well and good until that's no longer enough, at which point you may need things like dental implants or other significant surgeries. In these cases, some considerations that will be balanced with both your rheumatologist and treating dentist would be to consider any additional steroids to help prevent disease flare or changes to your steroid response as a result of the surgery. For those who are on steroid treatments for the long term, it's worth knowing that this can sometimes result in lower bone levels over time. Surgeries should always be carefully planned, including in these cases, and there should be a careful consideration of whether there's an alternate dental option that's less invasive but could provide similar or equal results. And regardless of what's decided, careful follow-up with all specialists and continued control of oral disease is essential. Next. So with that, I'll try to conclude my broad overview and hand it over to Dr. Trahan. We'll talk a little bit next about perspectives and tips for dental offices and care. I hope that I've been able to get you thinking about how partnerships between providers may improve your own care and general care. To think about oral lesions, which are common in lupus, can be severe and look like a lot of different things. We did talk a little bit about how lupus and its impacts may have different effects, including on oral health, the ability to maintain hygiene, quality of life, as well as creating challenges for access to care. But we also said that with most treatments received for lupus, oral health care delivery can actually proceed very safely, and more information will be forthcoming, especially on biologic agents. Next. And as we go forward, some other things we can keep in mind include the importance of understanding the patient experience, involving patients at all levels of care for the best outcomes, and that modifications may help us provide the safest and most comfortable care. And with that, I'll hand it over and really look forward to your questions at the end of the presentation. Thank you for your attention, Dr. Trahan.
Thank you so much, Dr. France. As Dr. France mentioned, I'm Dr. Natalia Trahan. I am the chief resident at the University of Pennsylvania School of Dental Medicine Oral Medicine Residency Program, and I'm graduating in June. So can you please go to the next slide? Thank you. As mentioned, we have no disclosures to declare. Next. And these are some of the references that we have used that are more evidence informed and are good resources as well. Next. And this is what I want to discuss in my part of the presentation. So primarily the disease and its symptoms, people at risk, risk factors, disease prevention and control, and available treatment. Next, please. And as Dr. France had gone over, we did create the connection linking lupus and oral health. And now I'd like to focus more on the home care that we can do for a lot of the disease or manifestations that are present, as well as linking the data. So the first thing I would like to start with is through the patient lens and diving deeper into the data. Next. So we did conduct a survey when we were speaking for the American College of Rheumatology, where we gathered data from the Take a Pain Check community, and that was the foundation that we did send our results through. So we reached an audience of 36 healthcare professionals and 51 patients. Next. And this was the demographics for our patients. So approximately 14% of our audience was lupus patients. And although it was a relatively low percentage, similar to our ankylosing spondylitis or rheumatoid arthritis or osteoarthritis patients, many of the responses from this survey are likely to be applicable even to our lupus population today, as they are to the other rheumatic populations. Our audience was majority female, 75%, and the demographic for this audience was also 40 plus majority, with a lower percentage of under 40 as well. And if you could go to the next slide, please. And we did ask this question primarily regarding communication, and that was, have you noticed a change in your oral health since being diagnosed with a rheumatic disease? And we did find that a good majority of our patient population did not know a significant difference from when they were first diagnosed, but there was a subset of the audience that did know a significant difference. Next, please. And we wanted to know if a patient's rheumatologist has ever discussed the potential impact of their oral health on their rheumatic disease or vice versa. And what we did find is that majority of them did discuss it. However, what we did find for the discussion was either one, the patient already had a pre-existing knowledge of oral health care, and that was because of Googling it, or a patient found that their family member was in the dental field or oral health care field, or they found this on social media. So they either discussed it and brought it up with their rheumatologist, or the rheumatologist worked in a setting where there was a lot of cross collaboration with oral healthcare professionals. So that's when they did bring it up. Next, please. And then we also wanted to ask if a patient has ever initiated conversation about oral health care with a rheumatologist or with a dentist. And we did find 63% of our audience had initiated the conversation. And the ones that didn't initiate it found that they didn't initiate it for specific reasons. One, they found that their dentist had actually discussed it with them already, and that was 10%. 1% found that their rheumatologist had discussed it with them already. And then 20% had found that they learned about it themselves. And that was either through social media, Google, through school, or having, again, a healthcare professional in their family. And unfortunately, 40% of these people that did not know that it was something to initiate did not know that oral healthcare was important. Next. So we asked them, what did you wish was more clear? And so primarily what they wished for was a connection. And thankfully, Dr. France has gotten a little bit more about the connection between oral healthcare and rheumatology. So I hope we're a lot more aware of that as well. They also wanted to know about the link between oral healthcare and rheumatology, and then preventative practices and financial challenges. There were other things that were important, including the rheumatologist role, management tips, lack of information that was present, effects of their medication, dry mouth, and the future. And then someone did mention that they just wanted to know everything. If you could go to the next slide, please. Now I want to really focus on dental dues. So taking all the things that we've learned so far, and from there really seeing what changes can we make either at home or in the healthcare office with our dental providers, and also things to ask our healthcare professionals. Next, please. So one of the things we also did ask patients is, what changes did you make to your oral health? And that was either with discussing it prior with their dentist or rheumatologist, or them making these changes on their own. So some of the things that they mentioned were primarily, the first one was switching to an electric toothbrush that they found was a little bit more helpful in maneuvering and being able to access more of their teeth. They also changed the increase of frequency of checkups. So as Dr. France mentioned, they had to increase the number of checkups to approximately every 3 months and have these more frequent cleanings as well. A few of them got things like night guards to avoid traumatizing their mouth, or if they had some kind of jaw arthritis, they used those as well. And then drinking more water to combat the dry mouth side effects, either that was primary from their disease itself or from medication effects. And they also did things like decrease sugar, use a special mouthwash or humidifier. Again, most of these suggestions were due to the dryness that they were finding in their mouth as well. They also increased the amount of flossing that they were doing, or use something like a non-foaming toothpaste. And then again, something that does pop up is that they started to use more expensive products because they found that more products were required in their dental care change. And if we could go to the next slide, please. One of the things that we really focus on as oral medicine providers, or even from the dental perspective, is to ask the question, can the patient do their own daily care? And on the perspective from a dental provider, it's great because yes, we want to encourage this daily routine. Even as a caregiver, if you're able for the patient to do their own daily care, we really want to continue encouraging this daily routine. However, if they're unable to perform the daily activities, and this could be from a manifestation of arthritic changes to the hand, or an inability to lift the toothbrush or the products, or even just being in a flare, that's when we want to involve a caretaker or a partner, or see if we can modify the techniques that are present. Next. So these are some recommendations that I want to bring up for oral care in general. So one of the things is to modify the tools. And this could include modifying your toothbrush, your floss, or even your toothpaste. We also want to increase the amount of fluoride in your toothpaste when you're going through this as well. And we want you to use more gentle toothpaste. Sometimes we find toothpaste that have more mint or higher amounts of flavoring can irritate the mucosa a little more, irritate the oral cavity. So more gentle toothpaste like Prevident, or children's toothpaste, Dr. Bob's, Tom's, or Squiggle, which doesn't have that foaming agent, can be a little bit more gentle in the mouth. And these are some modifications that are also present that I do want to quickly focus on. So the first is using putty to hold the toothbrush, so a bigger grip can be found, or using something like a tennis ball and creating a hole and sticking the toothbrush into the tennis ball, so you're able to maintain that grip and not use as much fine motor control. We also do have intraoral brushes that can be used as well if you're unable to manipulate with the floss. Next. And these are some more products or modifications that can be used. So again, the interproximal floss that can be used, the floss picks instead of using a floss string, because that can be a little harder to manipulate as well. Using things like a foam band or tape to wrap the toothbrush around your hand as well to manipulate it. And then these are some of the products such as the mouthwashes like the Prevident toothpaste or the Biotene mouthwashes that can be used for more dry mouth as well. Next, please. And I do want to caution with the following products. So these products are present, and usually you do get them in the hospital, and it can be useful then because it allows you to clean your teeth. However, the sponge tips can come out quite frequently, so it can be a little bit of a hazard when cleaning your mouth with this. And we do want to avoid toothpicks as well, as they can traumatize the mucosa. Next, please. So now I want to focus a little bit about that gum health that can be impacted with a lupus flare-up or lupus in general, where there can be that gingival irritation or the enlargement that can occur. So things that we can do at home is using warm salt water rinses, and that can be done a few times daily. And also a routine use of something like a water flosser or traditional floss to calm down the irritation as well. And we do want the regular dental appointments for both cleaning and or scaling and root planing where they go under the gingiva. And again, as Dr. France mentioned, those would be more frequent appointments. That would be approximately every 3 months. And then we want to use some mouthwashes to reduce plaque. And when using mouthwashes, we do want to avoid the ones that have alcohol, and we do want to avoid high flavored ones so it doesn't irritate your mucosa as well. And any medications as recommended by the specialist that you're seeing, and that specialist could include like a periodontist or even your dentist as well. Next. And then this is something else that we did discuss, ulcers, or Dr. France did touch upon ulcers in general. And I know the ulcers can vary from painful ulcers to more painless ulcers that you can get on the palate. So again, for these ulcers, you can use that warm salt water rinse as well, where you take some salt and mix it into warm water and rinse with that. You can also recommend things to your dentist like viscous lidocaine or magic mouthwash, which can help calm down the pain. So it just numbs your mouth a little bit so you can eat or do things for a few minutes. And then we do want to avoid traumatizing the mucosa, and avoiding traumatizing the area can be with two things. One, when we say traumatizing the area, it can be actual manual friction, or it can be avoiding it by high flavoring products. So things like spicy, hot, acidic, and very high flavored products like mint, vanilla, cinnamon, that can really irritate the area as well. And again, avoiding manually traumatizing the area. So you can consider something like a custom or an over-the-counter night guard to prevent this additional frictional trauma that's present. Next. And then let's focus a little bit more on the dry mouth. So we do want to focus or give high fluoride toothpaste, such as things with sodium fluoride. An example would be Prevident toothpaste, and then a more soft bristle toothbrush. And that could include an electric toothbrush or something like a children's toothbrush. And there are a wide variety of over-the-counter dry mouth products that can include gels like Bio Extra or Biotene. It can include products like Xylomelts, Zero Strips, Act, which can also be like a mouthwash, or a Xerostome. It can use lozenges containing xylitol, gum, and we do want to avoid gum or keep it at a minimum because of the additional wear that we are causing our jaw from chewing gum. So things like melts or sugarless candy drops are preferred over gum, so we avoid chewing excessively. And then keeping a humidifier in the bedroom. And we want to keep the humidity of this humidifier between 40 to 50% when the air is dry. Always, we want to keep water within reach and or suck on ice throughout the day so that we can keep our oral cavity moist. Another thing that we can do is coconut oil swishes, where we take some coconut oil and swish it around our mouth and then spit it out, not in the sink, but in a garbage bag so that you can throw it out and it won't clog up your sink. And also things like salivary gland massages, which I will demonstrate shortly. If we can go to the next slide, please. So this is a salivary gland massage, and this is very kindly generated by the Sjögren Foundation of Canada. So salivary gland massage, we have our sets of glands. So we have our parotids, and then we have our submandibular and sublingual glands that open over here and over here. So essentially with the salivary gland massage, what we're doing is we're trying to get the flow to come out, and we're doing some muscle movement with it. So essentially you're going to take your two fingers and you're going to go from the part of your parotid gland, so right in front of the area right in front of your ear, and you're going to push down, moving downward onto your face. And you can do that a few times a day on each side. And then the other part is where you are going, place two fingers, and it's going under the bottom of your jaw. And what you're moving is towards the center of your face where your submandibular and sublingual glands are. And again, you're sweeping your fingers with a gentle pressure. And as you can see on the arrows that are on the screen as well, you're just moving it forward to allow that flow to come forward. And you just want to do this a few times a day again. What I usually like telling my patients is the best time to do it is to make sure you can remember is when you're about to sit down for a meal. So one, you're increasing the flow before you're going to have a meal. And two, you're going to make sure that there's a routine a few times a day so that you don't forget it when you're at home either. Next, please. And then these are some things that you can discuss with your dentist or with your healthcare provider in regards to your dry mouth. So when you're going through these routine dental checks, you do want to get the caries check to check that there's no cavities that could be secondary to the dry mouth. And you want to go for routine dental cleanings as well. And in the office, you can receive fluoride as well. So either with fluoride trays or a fluoride varnish to protect your teeth further. And they can also prescribe you saliva substitutes, which some of you might be very familiar with. Unfortunately, there are a very limited amount of saliva substitutes that we can do, but these are the three that are the most common. One is cevimeline or Evozac. Two is pilocarpine or Saligen. There is calcium phosphate, which is Cafisol, but that usually is more limited to when you're an inpatient in the hospital, as opposed to something that would be prescribed as an outpatient regularly. And again, as Dr. France mentioned, when you have this dry mouth, there are other things that can be secondary to it. One is dyschezia, so a change of taste that can be present. Two is petechiae or white patches. And three can be a coated tongue. And those can be symptoms of Candida flaring in your mouth. And again, as Dr. France mentioned, we all have yeast at a baseline, but sometimes your yeast can be triggered a little bit more, and that can cause these symptoms. So a gram stain to check for these yeast, and then for treatment of these of the yeast that can be present can be done with your dentist as well. And that would most likely include an antifungal course. Next, please. And then some recommendations for cheilitis that can be present. So using sunscreen for the lip for protection is a really important thing to do, and avoiding of licking the lips. I know this is the habit that a lot of us do have, licking the lips, but it can cause more bacteria to form, and it can irritate the mucosa, the lip as well. And then using products like Aquaphor or Vaseline to continue keeping the lips hydrated, and using an antifungal product for the cheilitis if it is prescribed by your provider. And an example of that would be nystatin. And next, please. And some people did mention temporomandibular disorders, and I did see that in the chat as well. I know this is not as common in our lupus population, but it can occur for patients as well. So when you have temporomandibular dysfunctions, and that can be for a variety of reasons, one for arthritis in your jaw itself, or just myofascial pain from overworking your jaw. We want to limit the jaw opening. So we usually say like a 2-finger opening is what we want you to keep your jaw at. So it just kind of rests your jaw and doesn't overwork it. We want you to avoid hard, crunchy, and chewy foods. For those in Pennsylvania, that would be bagels, hoagies, and pretzels. And for other places, it might be other things. And then we want you to modify your sleeping position. I know I'm guilty of this as well. I tend to sleep more on my stomach or my side, but the best position to sleep in is on your back. And you really want to support your neck as well. So that could include getting like a towel under your neck or a special pillow that also supports your neck as well. And then you want to monitor your posture, making sure that, again, your neck is supported and your back is as straight as possible. Again, I know this can be difficult with a flare-up or some kind of arthritic changes as well. We want to rest our jaw. So that includes making sure that you're not clenching your jaw and being a little bit more aware of your jaw habits. And then, easier said than done, stress reduction techniques. So that can include a variety of ways to manage the stress reduction techniques. That can include things like cognitive behavioral therapy, talk therapy, or even medication management, or things like yoga and meditation as well to release that stress. When we're stressed, we tend to clench and grind our teeth. So just again, being aware of that. If you are doing things like working out or driving, and you notice that you have a habit of clenching your teeth, talking to your provider about getting a guard, whether it's over the counter or custom, and wearing it during those times, even when you're relaxing and you don't realize that you're clenching your teeth, can be helpful. and then over-the-counter products for pain relief. So I've included 2 examples of over-the-counter products. One would be Voltaren, which is diclofenac sodium, and the other would be a lidocaine, which is an anesthetic agent, and it's a cream. And you would just take a small amount and apply it extra orally, and you can self-massage as well the areas that are bothering you. And next, please. And then finally, I just wanted to touch a little bit about where you can get dental care as a patient living with a more medically complex disease like lupus. So at Penn, we have something, and we're very privileged to have it. It's the Care Center of Persons with Disabilities. And what we want to do at this Care Center for Persons with Disabilities is manage more medically complex patients. If we can go to the next slide, please. So what we do at this care center, we call it our P-Care suite, is we focus on educating and generating scientific literature. We focus on preventing, reversing, and arresting disease, and we provide personalized oral health care. Next. And another thing I do want to focus on is the access to care. So as I mentioned at Penn, we're a little privileged that we have this personalized care center for medically complex patients. A way as patients to receive this care, as this is one of the questions or concerns that we receive from patients living with rheumatic diseases, is that they don't feel comfortable going to their dentist sometimes to receive care. One, because the dental office is a little bit open, and if they are taking more immunosuppressive medications or they're experiencing a flare and they have to take off their mask in general, they don't feel comfortable, or that their dentist might not be familiar with their lupus itself. So a center like this personalized care suite can be helpful because they have closed rooms and they are a little bit more aware of things like lupus and how to care for it, as well as the oral manifestations. So the best thing to do also is go to the dental school in your area, as they are usually more familiar with dealing with more medically complex patients, or they may be able to guide you about dentists in the area that may be able to help you as well. And things to also ask the dentist, if you aren't able to find like a dental school in your area and it is a more private practice dentist that you're seeing, is, are you familiar with lupus and its potential effects on oral health? You can also ask them, I'm taking this biologic or this medication, and can you explain how it might impact my dental health or any potential interactions with any treatments or anesthesia? And then you can ask them things like, given my condition, are there any specific oral hygiene practices or products you recommend to maintain my oral health? And you can also ask them, do you communicate with my rheumatologist or other healthcare providers regarding my dental care and overall health? And then you can ask them, are there any dental procedures or treatments that I should approach with caution or avoid altogether with my lupus? So these are some questions that you can ask, just kind of gauge their interest or their knowledge about about your lupus and your dental health, and then see if they're willing to work with your other healthcare providers, including oral medicine specialists or your rheumatologist as well. Unfortunately, as Dr. France mentioned, and as we all know, advocacy is such a big part of living with the rheumatic disease, and you will have to advocate even for finding a dentist as well. And then finally, if there isn't any dental providers in your area, whether through a private practice or through a dental school, you can work with social workers and insurance companies to get transportation to and from dental offices. This does vary state by state. And the other option, if you are unable to leave your home, is home dentistry, where dentists can come to your home and provide dental procedures and dental treatment as well. Unfortunately, with this, there are some drawbacks, and that could include that it's expensive and it's not often covered by insurance in the US. There may be a lack of availability in certain regions, such as rural areas, and it may be limited in the scope of practice or the amount that they can actually do at home. Next. So in general, I just want to end with some key takeaways. It's really important, again, as a patient, unfortunately, you have to continue advocating, and you might have to open the conversation as well with either your rheumatologist or with your dental provider. We do want to provide some resources for patients, and we'll include that at the end. And you might have to also ask and check in with your providers, either your dentist or your rheumatologist, about your oral health care and your lupus. And then as oral medicine specialists, we are there to liaise with your dental team and your rheumatologist. We are that connection in between. So it's always great to really add us as part of your cross-collaborative team. Thank you. And next slide, please. And this is just a resource sheet that we had created at the American College of Rheumatology. It's a little bit more general in terms of oral healthcare and rheumatic diseases in general, but I hope there are some tips that can help you for your dental care as well. And if we can go to the last slide. And this is just the QR code for that resource sheet if you would like to grab it as well. Thank you so much.
Thank you so much. That was great information. And we really do appreciate you, Dr. Trahan, and you, Dr. France. I know that people have been busy submitting their questions and are very interested in this topic. So this, like I said, this was really great information. And I'm going to go ahead and we're going to move to our next speaker so we can hopefully have some time for our Q&A at the end. So I'm excited to announce that we have Danielle and Sandy. And so with over 20 years of dental experience, Danielle became disheartened seeing so many people go without dental care that they needed due to the high cost of the high out-of-pocket cost. As more medical insurance companies recognize dental procedures as medically necessary, Danielle became a medical billing specialist. She works as a patient advocate that helps patients navigate getting the maximum benefit from their medical and dental insurance for medically necessary dental procedures. She's dedicated to helping as many people as possible restore their health, smiles, and lives. And then Sandy brings over 7 years of dental experience. She has a passion for education to dental and medical insurance billing. And she began her career working for a dental practice and a family medical practice as an insurance specialist. Her interest and drive for options to access medical coverage for dental treatment became more personal when her college-age daughter was diagnosed with lupus, and just 18 months later, her son was diagnosed with Crohn's. Sandy enjoys working with dental offices that want to provide better treatment and financial options for their patients by accessing medical insurance benefits. And I know I've seen so many of you looking for resources for different dental care in the Q&A in the chat. So without further ado, Danielle and Sandy, we're excited to hear you.
Ashley, thank you so much for having us, and thank all you guys for taking time out of your schedule for being here. And Dr. France and Dr. Trahan, what an amazing presentation. We learned so much from you guys. And I have to say that a lot of what Sandy and I are going to be talking about, really echo, some of the things that the doctors have already told us. We are so passionate and have such a special place in our hearts for you lupus warriors. And our mission is really to help people like you suffering to really find the comprehensive care. And, as Dr. France and Dr. Trahan both said, it's so important for you to be your own advocate and really, communicate with your providers. And we're going to give you some tips and tools in order to really help you navigate this crazy world of insurance. We know it can be really difficult, but we'll give you some really good tips and resources to help you navigate through this process. Sandy?
Yes, next slide. So again, my name is Sandy. And yes, my passion for lupus patients certainly became much more forefront when my daughter was diagnosed. We're going to kind of dive right in. It's going to be real quick. We're going to give you some information about the importance of advocate, communicate, keep talking to the people, build that team, as Dr. Trahan mentioned. So let's go ahead and jump right in. Next slide, please. Obviously, you all know what lupus is, an autoimmune disorder that impacts several organs as well as your mouth. It is so vastly important that we're always communicating with and building that team. But Danielle, I'm going to let you take over right here and talk a little bit more about these 3 key points.
Absolutely. As the doctor's already mentioned, you are your own best advocate. We have to speak up for ourselves. You have to, really get in there. Don't take no for an answer, and let them know how these symptoms are affecting you day to day. Number one, educate yourself. Educate yourself on your medical and dental policies. All the policies have different exclusions, in and out of network benefits. So I know it can be daunting, but read through the policies. Very important. Number two, communicate. Talk with your medical and dental providers about your symptoms and how they affect you and your overall health. And be persistent. Dealing with lupus really requires a collaborative approach between the patient, the medical, and dental providers to really ensure that you're getting your everything managed properly. Next slide.
So the big word I want to focus on this is about overlapping always. If you have dental and medical insurance, you basically have overlapping coverage. And so both of those insurance policies can be billed for your dental treatment. As I said, my daughter has lupus, and even her hygiene visits are billed to our medical insurance. We do bill to dental first, and then we also include what's called a primary EOB, which is the first insurance that it's billed to. We include that EOB when we bill to medical. And they process it and sometimes pay on it, sometimes it applies to your deductible, but you have that overlapping coverage, and it's so important that you're accessing it because it can help you not just with your hygiene visits, but some of those more complicated surgeries and that kind of thing that Dr. Trahan and Dr. France had mentioned earlier. Next slide. There we go. Thank you. And again, this is something that Dr. Trahan and Dr. France mentioned, medically necessary. What is that? What does that mean in the scheme of things in the world, as far as your oral health? Dental care is medically necessary to prevent and eliminate oral facial disease, infection, and pain, to restore the form and function of your dentition, and to correct facial disfiguration or dysfunction. The treatment that you have is medically necessary. And so that's why it makes it that's why you're able to bill to your medical insurance. So if you keep that in mind when you're communicating with your dentist, that this is affecting my oral health, this is affecting the way I can eat, this is affecting the kinds of foods that I can eat, that becomes a medical necessity. And so that's why you're able to bill to your medical insurance. Next slide.
So we talk about the different dental procedures that might be covered under medical necessity. We talk about, different claims that are different services that might be covered under your medical. With that diagnosis of lupus, again, that helps us support a claim for medical necessity. And things like, comprehensive exams, oral cancer screenings, diagnostic imaging. I saw a comment in the chat that was asking about, how do I know if I'm a candidate for implants? Diagnostic imaging is the answer to that. We need a 3D image to see if you are a candidate for implants. And, sometimes those can be under your medical necessity. Any types of biopsies, treating oral infection, inflammation, trauma to teeth, dental implants can be considered medically necessary. Treatment for TMD, jaw pain, bruxism, headaches, Botox sometimes, sedation, sleep appliance, certain surgeries. So all those things could potentially be under your medical insurance. And with an autoimmune disorder as a diagnosis, that helps us support that. So if we go to the next slide, we're going to give you some tips on navigating the insurance process. And we know it can be time consuming, but it's worth the challenge. And Sandy is going to give us some tips on how we can actually get that done. Next slide.
So 4 bullet points to really focus on. Make sure that you are, be prepared to share your medical records with your dental provider. And again, that can be your PCP, your rheumatologist, all of those medical records. So that supports the dental provider to know what you're coming in with, what areas to be concerned about, and how it can impact your overall oral health, and plan, look at treatment plans for the future, treatment history. Secondly, ask if they have experience submitting medical claims, and don't hold it against them if they say no, because only about 3 to 4%, 3 to 5% roughly of dentists actually submit medical claims. And probably the majority of those are oral surgeons. But, I think the more we keep talking about it, the more we keep expecting that kind of service, I think we'll start to see a trend that more and more dentists will do it, which obviously supports the patients overall. Secondly, request a copy of your clinical notes from your comprehensive evaluation. That kind of information will build the need based on your diagnosis that you have lupus and it's affecting your oral health in this way. So you're kind of building the story, you're kind of painting the picture for that medical insurance to know, oh yes, we're going to be getting claims because this patient has lupus. And lastly, always request an itemized treatment plan that will list the dental codes from your dental provider. Those codes will become very important because the codes are what tells the story of what needs to be done. And so that's vitally important to have that, so that then it can be translated into medical codes as part of the medical claim. Next slide.
So how do we effectively communicate with your insurance provider? We talked a little bit about how to talk to your dental provider. Now, how do you effectively communicate with your insurance provider? Because again, if your dental provider doesn't submit claims, you as a patient can submit claims on your own behalf. So these are some of the things that you can do to submit a claim on your own behalf. So again, check your policy, be familiar with your policy. You have a portal. Every person who has commercial insurance, there's a website portal for you to look at. There is a wealth of information there. So if you have never been to your portal, I'll tell you today, go to your portal, look to see. You can look up all of the ins and outs of your policy. There's forms there where you can submit your claims. Oftentimes you can have a direct link to a customer service provider or a nurse, some kind of advocate that can help you there. And again, the squeaky wheel gets the oil, right? So the more that you are out there talking to them, asking questions, the more help you're going to get. Call your insurance provider, ask if those procedures are covered, just have a conversation with them. You can explain why that procedure is necessary. You can get an estimate. If your dental provider isn't familiar with doing that, you can advocate for that for yourself. The other thing that I want to kind of put in here that we haven't said yet, another really great question to ask your dental providers, if they do submit, if they don't know how to submit medical insurance, ask them if they can refer you to someone. And there's also some really great resources like the American Academy of Oral Medicine and the American Academy of Oral Systemic Health. Those doctors are very well versed in what you're dealing with. Going back to your insurance providers, ask for the customer service representative's name. Make sure you document everything. Documentation is everything. Ask for a reference number for the call and write down everything and keep records of that. So what are the steps to actually file the claim? Request the medical diagnosis codes from your physician or specialist. Obtain all of your receipts. Request a copy of your clinical notes. Statement from your dentist with the insurance codes and fees. You can contact your insurance provider for a health insurance claim form, or you can download a copy from their website or from your portal. Get familiar with that portal. There's a wealth of information there. Make copies of everything, review, send, and follow up. Next slide. There we go. So yeah, again, to file that claim. Those are the steps that you can take to file that claim. Get your claims forms, go to the portal, make copies, and follow up. And go to the next slide, please. But what if the claim gets denied? To be completely honest with you, most of the time, the first time they may get denied. But again, they're just not used to seeing us in that space yet. But as they start seeing more and more claims, we'll get more and more approvals. So if your claim gets denied, read the explanation of benefit. It'll tell you exactly why it was denied. Sometimes it's missing a document. It's missing a piece of documentation. You've got a wrong, letter in the wrong place. So sometimes it's just a matter of proofreading it. Call and ask the person who reviewed the claim the reason why. If you have all your documentation together and they're still denying it, ask why. Oftentimes they'll tell you. Understand why the claim was denied. It could be a clerical error. They may be requesting additional documentation. And you can always file a formal appeal. You can ask for your dental provider or your medical provider's help to help you write a letter of medical necessity, state your case, why you disagree with them, and have the patience. They need to respond to you within 30 days. So keep all that documentation and, don't take no for an answer. Next slide, please.
Danielle and I are always laughing because we all get those envelopes in the mail from the insurance company. And so often they go in the trash. Once you start submitting medical claims, you have to open those because that's your EOB. So just make sure you open your mail. That's my big tip for the day. So as we kind of wrap up and make sure that we've kind of pulled everything together and put a nice little bow on it, it's so important that you understand the importance of your oral systemic health. You have to be an advocate for yourself. I know Danielle and I have said it. Dr. Trahan and Dr. France mentioned it as well. You have to advocate for yourself and for your healthcare benefits. Request those benefits. Just reach out to medical insurance and ask what you're entitled to as part of that policy. And then finally, appeal any denied claims. Never take no for an answer. Always open your mail because there's an EOB in there, but always appeal those denied claims. Quite often they deny hoping that you're not going to respond. And quite often maybe the one that you appeal will get approved. Next slide.
So this is my amazing friend, Sandy. And if your dental provider is interested or has questions about billing your medical insurance, she does an amazing job with helping dental offices implement billing into their practices. And I'm Danielle. If your dental provider is not set up to bill medical insurance and you need a little help, I'm a patient advocate and I can help you navigate that process. And together we're hoping to, get all dental providers billing medical insurance at some point. So yes. The more we work together, the more benefits we'll be seeing. So thank you so much for having us. And
thank you both so much. I'm so sorry. Go ahead.
No worries. I was
We're
just
here to
writing
answer
up,
any questions.
Yeah, somebody asked about our email addresses for contact, and it's actually on the very first slide when our presentation started. So hopefully, if you once you watch it back and see the recording, you can get our information.
Great, thank you. Yes, and we will be sending, I know there have been a lot of questions about that. So just a reminder, again, there will be a follow-up email where we will have a recording, and we also post the recordings to our website. So I will go ahead and invite all of our speakers back on camera. I know that we are short on time, but we have covered a lot of information, and I have seen everybody be very busy in the background answering questions. So although we're short on time, I do feel like we've been able to answer a lot of really great questions that people have submitted. So I thank you all for being able to answer those questions. And I just have a couple of questions that based on the Q&A in the chat that I've seen that I'd like to answer or ask before we wrap up this evening. And I saw a couple of questions really mentioning, how do I find a dentist that is familiar with lupus or other autoimmune diseases? So do you have any recommendations of how to find a dentist that would be familiar with lupus, or is there a particular specialty that they should be looking for when they select their provider?
Well, I believe that the American Academy of Oral Systemic Health and the American Academy of Oral Medicine, those two are just fantastic resources, and both of those websites have directories of doctors who are actively participating in this cause. They understand the oral systemic connection, and they are fighting to get more medical benefits for their patients. So those are two great resources.
I agree, and thank you for highlighting those academies again. I think the other resource that I would repeat, as Dr. Drahan said, is that many people may live in proximity to a dental school of some sort, and that is an excellent place to get a wide variety of specialists with advanced education, certainly in systemic disease, but also in variety of different dental specialties and advanced dental procedures. And unfortunately, I know that's not still everyone, but that may be a good place to start your search.
And I will say the schools are a great resource financially as well. Oftentimes they'll work with you financially. Yeah. So not only is it a great collaborative effort, but it's definitely worth the effort of getting in there.
Yes, so you actually answered my next question, and that was really, do you have any recommendations for any resources outside of insurance billing? I saw a lot of questions for funding for implants, and we know that dental care is expensive, and dental insurance, even if we're getting it covered under medical insurance as well, it doesn't cover everything. We will put a link in our chat. We do have a couple of financial resources on the Lupus Foundation of America's website of organizations that can provide assistance, but do you have any other recommendations? I know you mentioned going to a dental school is a great place to start as well.
We really advocate for getting as much as we can under the medical insurance. And I know we can't get everything, but if you think, there's no annual limitation, like dental only has, about 1,500 to 2,000 is their annual limitation, their annual maximum, where medical does not have that. You can only have 1 or 2 exams a year under dental, where, under medical, they just don't have the limitations. And more medical insurance companies are recognizing this, especially if we can support it with medical necessity. We just, the dental industry is new in doing this, and they don't speak the language yet, but that's what's so beautiful about these other, the Academy of Oral Medicine and Oral Systemic Health. These doctors are collaborating, and it's making it easier for us to make progress in that area.
Agreed.
Great information. So I will close out, and I want to give everybody one last chance to talk. So I will ask you all the same question. I'll start with you, Dr. France, but if there's one tip or one piece of information that you hope that everyone takes away from tonight's program, what would that be?
Well, thank you very much for letting me go first. And thank you again, everyone, for having me and for asking such wonderful questions. And I hope it was helpful. I think that one thing that we all said over and over again is that there are resources out there and there is help available. And while sometimes that requires advocating for yourself and looking at different options or submitting a claim multiple times, it is possible.
Great information. Thank you. Dr. Trahan?
Thank you so much. Unfortunately, Dr. Prince stole my answer.
That's okay.
I'm gonna think of another one, but just to sort of build on what we both said, is starting off with the dental schools, or even if you're not able to get dental care in the dental school itself, they might be able to have the resources in order to then expand your dental care. And I also did want to mention, a few people did ask about the email, the questions I was mentioning. So I have sent that over. So that will be shared as well, questions to ask your dentist.
Yes, we're going to do our best to get that into our follow-up email. We appreciate you sending that over. Thank you. Danielle?
Communication. We have to open up this conversation. It has to start with you. You guys are the warriors, and we need you out there, advocating for yourself, talking to your medical and dental professionals, and getting this conversation going and making sure that they know that you need these benefits.
Perfect. And Sandy, we will give you the last piece of advice for the evening.
If you speak to a dental provider and they say, no, we won't bill the medical, say thank you very much and make another phone call to somebody else, because that's what we ended up having to do with my daughter. I think she called 2 or 3 different dentists before she found someone who was interested in working with her and would consider doing medical billing. I ended up helping them do her medical billing, but at least they were willing to talk to her about that. So I think that's the biggest thing for me, is if you don't find someone who's willing to work with you where you're at, call someone else.
Good advice. Well, thank you all so much. This is great information. The slide that we have up here is just how you can get in contact with the Lupus Foundation of America. If you haven't checked out our website, it's a great place to get connected with our resources and tools. And as I mentioned, we have a lot of other programs and services that I didn't mention tonight. So please be sure to visit that, and you can get connected with us, learn about more upcoming programs that we will have as well. Let me get to the next slide.